Welcome to Scoop and Scale, where we dish up the science and weigh the facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and pony owner. I'm a dressage rider and at-home horse keeper, living the challenge of managing easy keepers on multiple acres of pasture.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and like all good horse friends, we're always talking horses. We talk about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode.
When we asked our listeners what they wanted to hear about in 2026, equine asthma came up over and over. This is a topic of personal interest to us as well, as Jill has a pony with equine asthma, and I developed an interest in lung health when I was teaching equine exercise physiology at UC Davis. Here today to discuss the topic of equine asthma and the things we can all be doing to protect our horses' airways is Dr. Laurent Couëtil. Dr. Couëtil is a veterinarian, internal medicine specialist, and the director of the Donald J. McCrosky Equine Sports Medicine Center at the University of Purdue. His research work focuses on the detection and treatment of respiratory conditions in equine athletes. Dr. Couëtil, thank you so much for joining us today for this episode of Scoop and Scale.
Hello, and thank you for having me. It's a pleasure.
Before we get into today's topic, could you share a little bit about your background and the work you do at Purdue?
Yeah, of course. So first of all, I grew up in France, in Normandy, on a small farm where basically we raised race horses and so bred brood mares. And my dad was also a trainer and did ride as well in racing. And naturally, I had two options, staying on the farm or being a veterinarian. So I chose the latter. Went to vet school in Paris and then I ended up practicing in north of Paris. It's a large thoroughbred training center for racehorses, and was there for about 6 years or so. And then I had a change in my interest, really wanted to pursue some other direction, was very interested, when I was reading articles, scientific papers. It was really interesting to see a lot of that information coming from American universities. And so I was lucky to match for a residency position at Tufts University in Boston. So I went there, and then I did I got very hooked into research. I did a PhD after that in respiratory physiology at University of Liège in Belgium. And then Purdue was my first academic position as a professor, starting my career there, and I stayed there. So somehow, 30 years later, I'm still here. So I've liked it.
You must be doing something, right?
Yeah. No, it's a very, very wonderful environment. So
that's awesome.
Here I am.
Yeah. Now that area of France is lovely. Normandy's a beautiful area. So,
yeah, lots of horses there.
Yeah, there are a lot of horses there. So staying fairly high level, I think it would be good to start out with us understanding what exactly is going on when we breathe.
Yeah, well, the way I think of it is really two main, mechanism, if you will. One is really first getting air into our lungs, so there's purely a mechanical system at work there. And I kind of often compare the respiratory tract to a syringe with a plunger. And essentially you pull on the plunger to get, liquid in if you're going to do an administration where here air is coming in. And what it's putting on that plunger is your arm muscle in this case, but in our interest, the respiratory tract is the respiratory muscles, so mainly diaphragm, but other muscles, play a role. So first you have to get air in and out the lungs. So that's kind of what we call ventilation, if you will. And then the second aspect is obviously that oxygen that's coming in with the air has to go and load into, diffuse across the capillary bed, and deep in the lung, load up on the red blood cell in the blood, and then the heart will pump that blood to the body, and in particular the muscle, and then the muscle will utilize that oxygen to contract, to make energy so they can contract. So kind of two different type of mechanism, and depending on the type of disease you are dealing with, some diseases may affect more the ability to get air in and out. This is actually the case with asthma. But with others, especially with infectious diseases, often is the alveolar sacs, deep in the lung are filled with the pus, with the bad stuff. So actually air can't, diffuse properly. So, a different aspect of the breathing can be affected depending on the disease process.
So one of the things that interested me when I was teaching exercise physiology, that I found a lot of students who had horses and were riders did not realize was the respiratory locomotor coupling that happens in horses who are, once they get sort of into a canter or a gallop, the fact that is tied to their stride, which is different from us. Mm-hmm. Because I can run and choose to breathe in for 3 strides of running and out for 3, or in for 4 and out for 4, or in for 2. I can decide that. And it really blew their minds that that's not the case with horses that are cantering or galloping.
Yeah, of course. Yeah. So, but horses, in a sense, are fairly similar at their trot. They can choose to breathe, a few times or not. But yes, as a gallop, what we think is going on is, the horse has that gait where when they gallop, they essentially land on one forelimb, and they pivot over that forelimb. So you have all the gut, that come rushing forward at that point,
Yeah, it slams into the diaphragm, right?
Diaphragm. So you don't have any other option than just breathe out, And so that's the most economical, as far as their breathing strategy. So yeah, you're right. Yeah, horses are, from that standpoint, are kind of unique compared to us. Mm-hmm.
Yeah.
Horses have a range of breaths per minute that's considered normal and healthy. What's a normal respiratory rate, and what's the best way to measure it?
Yes, so respiratory rate is pretty low in horses. Usually can range between 8 to 15 breaths per minute. And the low end of the range is, if you notice during the winter, actually horses tend to breathe much slower. I've seen horses sometimes at 6 breaths per minute. Okay, when is the next time you can take your breath? And then obviously with, warmer weather, they need to also cool down. And so their respiratory rate will be a little bit higher. And of course, we know that, any kind of excitement will make the horse also breathe faster. So, when you measure breathing rate, you want to make sure you are kind of in their usual environment, quiet. You don't kind of interfere with what they are doing. And so how do you do it? The most reliable way is to actually look at their flank and how they, push air out. You see the abdomen kind of tucked up when they exhale and kind of relax when they inhale. The horse, again, is unique, actually, among the domestic mammals, is that they have an active and a passive phase, both during inspiration and expiration. So what I mean by that is, for us, when we breathe, you take a breath in, it's active. You have your muscle contracting, especially your diaphragm, pulling on that plunger, that's breathing in. But then exhalation is, you relax all these muscles, and passively, the lung is a rubber balloon, so it recoils and will push the air out without the need for you to contract any muscle. Well, the horse is not like that. The horse, the first phase, of expiration. So there will be a passive, phase there, and then they'll end up expiring with abdominal contraction at the end. So that's what you see, the abdomen being tucked up towards the end of expiration. It's pretty subtle. Normally, there shouldn't be a big, push to breathe out, but there is a slight abdominal component to the end of expiration. Versus for us, expiration is completely passive at rest. And then because there's that active component at the end of expiration, the beginning of inspiration in the horse will be passive. Those muscles relax, you start inspiration, and then the plunger kicks in, the diaphragm kicks in. So horse is a bit unique. So look at your horse from the side, kind of three-quarter, look at the flank region and look for that motion of the abdominal wall, up with each exhalation. And the best is to count over 1 minute, because horses breathe so slowly, you're going to make big mistakes if you just do it for 10 seconds and say, okay, I'm going to multiply by 6 and I'm going to have the breathing rate by, per minute. Well, actually, some vets, where we are busy, we want to do things a bit faster. We count over 15 seconds, multiply by 4. But I can tell you, I showed actually on a research project why that was a problem is because we missed the response of the horse when we did that. So
that's interesting. I think a lot of people think they can just do it for 15 minutes and that's pretty accurate. So
you fake them, but other thing is you could actually feel the air coming out of the nostril when the horse breathes. And it's true. And if you do this, come put your hand close to the nostril and actually put the dorsal aspect, the top part of your hand against the nose, because this is where you have the most, you feel the best the change in temperature and the air moving. But as you know, if you do that, the horse will want to smell your hand. So, they're going to sneeze, they're going to, not have their normal, breathing rate. So, to me, it's not a reliable way to do it that way.
Yeah, they'll either sniff your hand or think you're being really weird and back away.
Yeah, exactly. Or they'll hold their breath because they said, humming, or, are you giving me a cookie or whatever, a treat, and they'll sniff. So, yeah, that's not reliable in my mind.
My pony that has asthma sometimes had an elevated resting respiratory rate, which was one of the things that alerted me that there was something that was not quite right. What does abnormal lung function look like, and what should owners be on the lookout for?
Yeah, that's a very good observation. And increase in respiratory rate is often the issue, especially very consistent about it, versus a healthy horse. You might get excited, or breathe faster, but then recover very quickly, versus the horse that has, especially severe asthma will be constantly having a higher rate. So a few things besides this that you can look for. One is the nostril flaring. So in horses that have severe asthma, because they have that air hunger, they have really this increased breathing effort. You'll see these nostrils, flaring open. And that's really an indication that they are really having a hard time just with each breath. Of course, again, an excited horse will do that, but then will recover and then, will not flare. And so normally horses, that are at rest, their normal self, quiet, will not flare their nostrils with each breath. The other thing I would say is that abdominal effort that I was talking about, that you look for to count the breath will be much more pronounced. And, to the point that's why the disease, when it's severe, has been called heaves, is that heaving, of the abdomen with each breath. These muscles essentially have to squeeze much harder to get the air out of the lungs. And we can talk about, why that is. But so that's really, the signs that I look for. But this is for kind of the most severe part of asthma, these horses that are truly heavy, But certainly we know, especially in our athletic horses, that it can be much more subtle. And so in those horses, it could be just, a poor performance type, complaint. so what does that mean? Poor performance. It's not very specific, of course, but with these horses that have milder form of asthma, it may be that they have just a longer recovery time. You exercise them, you work them in the arena, and normally they catch up their breath, within, a few minutes. And now you're 10 minutes later and it's still, huffing and puffing and that kind of. Right. Or you're riding your horse and you start, feeling that abdominal and thoracic movement, much more than before. Your legs are spread apart because the horse is really breathing hard more than usual. Certainly coughing is a big sign, with asthma. But also we have a lot of horses that have asthma and do not cough. So it doesn't exclude it if they are not coughing. And then sometime in our elite athlete, the one that exercise, strenuously, I'm thinking about, race horses, of course, barrel racers, things like that. They may just refuse to go to the event, refuse to perform because they know it's going to be, hard for them to breathe. I'm trying to think, okay, what may they feel? Is it just a sensation of not getting enough air? Which is certainly what people with asthma describe. That air hunger, running out of air. So I've seen certainly horses, in barrel racer, for example, they don't want to enter the gate. They don't want to go out and run. Or the jumpers, that just hitting bars now. He was jumping well, and now it's just seems to be not able to do what he could do no problem before. So the problem with that is often it's non-specific. You could have really a myriad of other conditions, are going poor performance. So that's the challenge for us as veterinarians, is to try to figure out, okay, is this really the horse is in pain, has a lameness, and it's just not obvious when you just jog the horse, but you have to look at it, when it's doing its real thing and to figure out. And sometimes it's actually respiratory. So that's.
I think it's important to mention too, because we did talk, like you said, you've seen horses as low as 6 on the respiratory rate.
Yeah.
When you're looking at this, you should kind of have a baseline of what your horse's respiratory rate is, so then if it is actually elevated. And for my pony, when it was elevated, it would be like 36 to 42, which is severely high. I mean, you're definitely going to see it at that. But, it's great for every horse owner just to know, go out there and count it for a minute and know what your resting is.
Absolutely. I agree completely.
I've also had horses come in, for nutrition consultations where owners have talked about, allergies, and they've come to me because they're struggling to keep weight on the horse. And I've actually, we've had a conversation, and I've actually said to them, have you actually had really had your horse's airway worked up by your veterinarian? And often they haven't. And having that conversation with them, that part of your, the inability of your horse to maintain weight may be that it's actually burning calories just trying to breathe, standing around. That it's hard work. It's working way harder to just breathe than a normal, healthy horse. And I don't think people realize that either sometimes.
Yeah, absolutely. Yeah, it's been shown in people with some of those chronic diseases like COPD, as much as 40% of the oxygen they burn, will go to the respiratory muscle. Normally it's less than 5%, so there's definitely a huge increase in energy need when they are breathing hard, like your pony, Jill, that you're describing,
Yeah. I remember being, shocked when I took a bit of a deep dive into lung health when I was teaching exercise physiology, that the fact that you can't improve lung health, through conditioning the way that you can, with some other systems of the horse, right? You can make their muscles stronger, you can make their heart beat stronger, pump more blood around the body, but you can train skills, you can, do all those sorts of things through training, but you don't really improve lung function through exercise. So it is a major limiter of performance. And again, I don't think people realize that. Can you talk a little bit about the importance of lung function to health and performance, and why should we care about horses' lung health?
Yeah, of course. Absolutely. This is something that we've learned exercise physiology already a while back when we were looking at the effect of training, on the body and which, body system, adapt which one might be limiting. And that's when we found out that, yes, the respiratory function, especially the maximum amount of air that the body can pump in and out, so we call maximum ventilation, is really a fixed entity. And so I often use an analogy here again and comparing the horse athlete to the sports car. And so to have, an optimal performance, your sports car needs to have, a powerful engine. So these are the muscle of the horse that could propel your horse. So you need that. The other thing that's obviously is needed is, a good amount of, that fuel has to be coming to the engine, at a high rate, that's the carburetor. And that's the equivalent of, the heart pumping the blood and the blood full with oxygen, towards the muscle. And then, of course, you need a strong chassis in that race car and tires. And so that's the horse's, legs and bones and tendons and feet and all this needs to be working, optimally. But the fuel is really what's really generating all that energy eventually. So that's that oxygen that the lung is delivering, so the blood can carry that to the muscle. And basically the analogy to me is that you can't change that type of gasoline that the horse, there's 21% of oxygen in the air that they breathe in and out, and they pump the air in and out the lung to try to get in as much as possible. That's a finite number. But with, training, as Claire was saying, with training, the muscle become hypertrophied, obviously you can see it from the outside. That's easy to realize that the horse is getting conditioned. It's like us. If we go to the gym every day, at one point, we're going to see the results. Things that we see less clearly is there are changes in the heart as well. The heart will also, as a muscle, will become, more efficient, will pump more blood out. Each time there's actually more red cells that the horse makes when they are fed, so you can carry physically, the horse can carry more oxygen and deliver more oxygen to the muscles. But again, that fuel, that amount of oxygen that can be taken in is a finite number. And with training, even though you think, well, the diaphragm, for example, is a muscle, but you cannot actually get more air in and out with training. And one thing that really hit it home is if you look at, for example, blood oxygen level in horses that exercise, when they are not trained, actually the blood oxygen level remains pretty normal, like when we are standing here. And the horse really stops exercising because, he becomes fatigued quickly, it's not fit, etc. But a fit horse, their blood oxygen level will drop, and pretty dramatically, to a level where if you would measure that in a person, you would say, okay, you need to go to the ICU to get oxygen, nasal oxygen, because you're going to, pass out. While horses run and race, with that very low oxygen level. So we always say, they're basically teetering on the edge in the sense that they reach the limit of physiology, what's possible when you push, your muscle, you train, your heart is trained. This is so much that the ventilation can do. And so that's really why the respiratory function is a limiting factor to performance. Yeah. This doesn't adapt with training. And the other aspect is, sorry.
No, go ahead.
The other, one of the reason is you have to remember that horses have to breathe through their nose. They cannot open their mouth and
that's a good
their mouth. And as you well know, it's harder to run and just breathe through the nose. At some point you say, okay, I need more air, so I open my mouth and I can get more air. And well, horses cannot do that. So, on the other hand, they have certainly larger nasal passages, comparatively to us. But still, we know it is a limiting factor.
Yeah.
And, but another limiting factor is actually their heart is too big for their body. They pump blood through the lungs so fast that the red cell don't even have time to fully, load the oxygen. So
yeah, they are amazing. There's a for anybody that's really curious about all this. When I used to teach exercise physiology, I found an amazing documentary on PBS called Inside Nature's Giants. And this was a group of anatomists and physiologists who would look at amazing animals. One time they did, it was, is a tiger just a lion with stripes? Right. And they looked at a lion and a tiger that way. And then they did the racehorse. It's not for the faint of heart because it is a dissection. They do dissection, but they dissect out the lungs. And so to your point about the plunger, they actually show the lungs it is amazing. And then they put a leg under load and they cut the tendon in it. So you see what a leg under load is really doing. If people are interested in like some of these amazing adaptations horses have, it's a great documentary. It's about an hour long and it is on YouTube now. So you can get it online. I just looked it up while we were chatting. So that's Inside Nature's Giants, the racehorse. It's fascinating. But I'm also reminded, you mentioned earlier, you said something that caught my attention, which was not all horses with asthma cough. But I wanted to, this thing about coughing, because when I was a kid riding, I remember being told, as long as they blow their nose after they cough, if you're out riding and you start trotting and they have a bit of a cough, as long as they blow their nose, it's fine. And nothing to worry about. And, I think generally owners think that a cough when the horse starts trotting is not a big deal. However, I heard one of your peers give a lecture and she talked about this and she made the point that, if we have to run to catch a bus, we don't suddenly start coughing. And, it's not normal if we pick up a slow jog to start coughing. And yet somehow we feel that in a horse, this is normal. And she was making the point that it's not normal. So I was just wondering, what are your thoughts on, it's so common. I mean, my daughter's pony does this a little bit. You pick up a trot sometimes, especially in the spring when the pollen is high. He has a couple of coughs and then he's fine the rest of the ride. Is that normal? Should owners be concerned by that kind of behavior?
So sneezing is normal.
Okay.
This will start exercising and will sneeze, which is obviously a different, physiologic is different from coughing. Actually, the cough receptors are starting with the larynx, the voice box, and then further down, deeper in the lung. In the nose, would sense irritation or change in temperature, especially when the horse starts exercising, for example, or air is not as moist. And so all of this can trigger those receptors in the nose, but then the response is sneezing, which is very different. And so to me, coughing tells me, yes, there's somehow those sensors, say, okay, something is irritating the airway, and I'm going to tell the brain we need to cough. And so what are those things? So you could be breathing air with a lot of dust, for example, and that's a normal protective mechanism. The lung is very good at sensing what's coming in, and that's why if you swallow the water the wrong way, you're going to cough right away, to protect the lungs. So
right.
A well-designed system. Same if it's very dusty, if you clean the stall and it's, you see the plume of dust here.
Right.
You're going to both sneeze and cough. And the other thing is if the lung or the airway is already irritated, so it's inflamed because of asthma in particular, then just the fact that you breathe in, faster, for example, with the beginning of exercise, that can by itself just trigger coughing. Or often the way the airway responds to irritation is by also stimulating mucus production. So if you have a lot of mucus, sitting at the top of the airway, and then you have air moving in and out fast now, that would move the mucus a little bit in and out. And that can trigger that response as well. So obviously, just one cough may not be a big deal, but certainly if it's more consistent, it usually means there's something abnormal with the lower airway. Because as I said, the cough receptors start with the throat, kind of the larynx, and then all the way down, but not the nasal passage. So it's important to pay attention to that. And of course, it depends a little bit what the horse is doing. If it's my broodmare that's, coughing once or in a while or whatnot, but everything else seems fine, I'm not too worried. But if I have a racehorse or, a 3-day event or a barrel racer, then I'm thinking these horses need 100% of their respiratory function.
Right.
So then I need to really look into that.
Yeah. That makes sense.
Well, as we've mentioned, I'm more familiar than I ever wanted to be with equine asthma. But for people that don't know, can you explain what is equine asthma? Physiologically, what is going on in that horse that is affected?
Yes. So first of all, to me, asthma is really a spectrum. It's not just one thing. We talked earlier about, the heavy horse. So that's kind of one end of the spectrum. That's severe asthma in horses, where you see just at rest, they have a hard time catching their breath. They heave, their nostrils are flaring, they often cough quite a bit. So that's one end of the spectrum. And then you have, the other end, the mild form. It could be that racehorse, that show horse, that's, again, may or may not cough, but it may be more for not optimal performance, compared to before. Harder time to recover. And so much more subtle that can be really essentially mimicking other things or looking like a horse that has more of an orthopedic issue, or a muscle issue. So that makes it really more difficult to diagnose. So what typically we see with the heavy horse, these horses will tend to be a bit older horses, mature to older horses, and they often would have period of time when they are that, having that hard time breathing. They are what we call in crisis, and like an asthma crisis, literally. And but they can get better, either with medication or if you take away what's triggering it. And I'm sure we're going to talk about that soon. So there's that kind of waxing and waning, but we consider that these horses will be affected for life. Essentially, it's something that you'll have to deal with the horse for the rest of their life. And this is quite common, especially what I would call the northern climate, and temperate climate. So, Northeast in particular, and Canada, and that kind of areas where basically you have cold winters, horses are indoor, fed hay, and that's when they flare up. And usually those horses, when they're out on pasture, they just look completely fine, and you can tell something's wrong with them. So it's that, ability to cycle between those time period. And we know there's about 14% of horses, in that mature category that suffer from severe asthma. So it's quite common.
Quite a lot.
Yeah.
That's quite a lot.
And we see that a lot in Europe, Northern Europe in particular. But there are also some that can be affected, when they're actually at pasture. They look exactly the same, having the same hard time breathing. It doesn't happen during the winter, is when they're actually out, middle of the summer, June, July. And those are the ones living more in the southern states, here in Florida and Louisiana and so forth. So in those horses, when they are in crisis, they are pretty, obviously affected. And why do they have the difficulty breathing? Is a couple of things. Again, going back to my analogy of the syringe and the plunger, well, imagine that you put at the front of that plunger, that syringe, a very tiny needle. You have to basically, pull really hard to get, liquid through that. And it's like us, breathing through a straw. So what's happening in those heady horses, they have narrower airways in their lungs. The nostril and the upper airway is fine, but as soon as you go deeper in their lung, as it branches like the tree branches, each branch is closing down, and it's closing down for different reasons. One is there's a muscle around each tree branch. That's called an airway smooth muscle. And the reason it's there is what we are talking about. You breathe something that you shouldn't, the airway doesn't want that. It shuts down and you cough out. So you want to limit what's going deep in the lungs. Okay, so it's a protective mechanism. But in the case of the asthmatic horse, it's hyper-reacting and hyper-responding. That smooth muscle is actually bigger than normal, and it clamps down on the airways. The other thing is those horses essentially have an allergic response to what they breathe into, that dust that we'll talk about in a minute. And that triggers a lot of irritation. We'll call that inflammation. And that inflammation results in the thickening of the airway wall. So you have a cylinder, where air goes through, but now you have both a muscle that clamps more on that cylinder, and then the wall of that cylinder is thicker. So the lumen inside is narrower. So again, it's harder to get air in and out. And the other factor is, as I mentioned, one way the airway responds to irritation, inflammation is making more mucus. So you can imagine you have a narrow airway. Now you plug it with some mucus in there, and makes it, also harder to move air, through in and out. So that's really the reason why horses have a hard time breathing. Everything is narrower and more difficult. So, on the other end of the spectrum, the milder inflammation, they still have airway irritation. Everything is milder. You don't have as much of the constriction. The muscles are typically minimally remodeled, and you still have excess mucus because that's how the airway responds, and that inflammation. But often they are not, obviously as severe as the heady horses. But because it's fairly silent in terms of the signs, as I mentioned, they may not all cough, and they maybe, decrease performance. But again, many other things can cause that. It's often not detected until you do very specific tests. And when we did some studies, for example, in our top athletes, the racehorses, we found that 80% of them had airway inflammation that's consistent with asthma. And guess what? The more severe the inflammation is, the lower their performance.
Right. And, I think it was Dr. Emmanuel Vanner reported very similar findings in some horses that went to the Olympics a couple of Olympics ago. She worked with some European horses and scoped them all and did some workup on them all. And these were all horses that were jumpers and competing. They were Olympic level horses. They were very successful. And I think it was similar, like 80-something% of them had treatable airway issues.
Yes, absolutely. And so again, because now we have tools to really detect, with high sensitivity, what's going on deep in the lung, then we realize, oh, that's not normal.
Right.
Because, we had discussion with other researchers is, why do you put the cutoff for the degree of inflammation, so low and not, above there? Because we can't find any horse, that are that low. So, well, if you look at the effect on performance, then that it is a negative effect, on performance.
Right.
So they should be there. The question is really, why is so many horses, had that low grade, inflammation?
Yeah. So are we not using the term HEAVS and chronic obstructive pulmonary disorder anymore? Are we now just using equine asthma, or do those terms still get used?
Yeah, so HEAVS is appropriate. I think it's, it speaks to just a severe form of the disease. I think everybody kind of has an understanding of that. The term COPD doesn't fit anymore. So that was used, back in the 70s, actually, it was introduced in the equine world by some researchers in Europe. And it's because at the time, we knew about the type of inflammation that humans had with that COPD condition, chronic obstructive pulmonary disease. And in people, we know it's triggered by essentially smoking, tobacco smoke exposure. And so, yes, you have coughing. Yes, you have excess mucus in the airway. Yes, you have inflammation, especially a neutrophilic inflammation, we call it. It's a type of cells, that can get to the lung when inflamed. The problem is the process is very different. And now we recognize in people that asthma is one type of thing and COPD is a different. And people with COPD essentially have airway obstruction, but it's gradually getting worse over time, to the point that people at the end, need nasal oxygen, they have emphysema, and whereas with asthma, as we are talking about with Hives, you have a period of time when an asthmatic person, like a horse with Hives, can be completely normal. They are not exposed to what is triggering the asthma. So that's why we really don't want to use the term COPD. It's not appropriate anymore. But Hives is appropriate, but just for the horses that are at the end of the spectrum. For that, athletic racehorse, they're not Healy. They just have a much milder form. And I think what we recognize is there are different type of asthma in people, and there are different type in horses too, and some of them match pretty closely to each other. And I think that's when you dive down into the mechanisms, etc., there are a lot of commonality between asthma in people and many horses. So it made sense from that standpoint, from the scientific standpoint, to use the term. But also I found out that when I was using the older terminology in people, we used to call recurrent airway obstruction and inflammatory airway disease and RAO, all these acronyms, I spent an enormous amount of time talking about what that meant. But when I say your horse has asthma, everybody has that already understanding of the disease.
Yeah.
It clicks. They know you must be breathing something that you react to. It's an allergic response. And therefore you have all that acquired knowledge already, helping you, helping the client. So
this makes a lot of sense.
Yeah, the reason why we recommend if you use that terminology.
So are respiratory allergies a primary cause of equine asthma, or do they just make an already existing condition worse?
So Hives, for example, is a true, allergic condition. And, for example, you may have a barn with 10 horses. There's one horse that's heavy. They all live in the same condition,
right.
Same environment. They get the same hay, they get the same bedding, whatever. But so why is this horse reacting and having this problem and not the others? So, yeah, and there's a lot of argument to indeed show that it is an allergic response to inhale dust, in particular moles in the dust. They react to that. They react also to some other component of the dust. Dust is not the clean, little mold like this. You have also bacteria and endotoxin, we call it, and that really enhance that response. For the horses that have the summer pasture version of Hives, it's we think they react more to pollen, in the air, or there's also moles in the pasture. So it could be part of the issue as well. And then for the less severe form of the disease, we really did a lot of studies to try to tease out, is this more of an infectious response, or is it more, again, an irritation allergic response?
So is there any research into environmental components that are contributing to equine asthma? For example, dust, molds, and pollens? It sounds like that there is.
Yes, a lot of research on the triggers for asthma in general, and our lab has been really focused on that for quite some time as well. So what we found is certainly for the severe form of asthma, we talked about the fact that, the classic form of the heavy horse, when they bring them in the barn in the winter and feed them hay, and within a few days or a couple of weeks, they might trigger, the difficulty breathing. So in fact, they are reacting to inhaling small dust particles that contain especially, mold particles, but also those small particles are coated with some, bacteria and endotoxin, we call that, and kind of work together. And it's not just additive, actually, it's a synergy. So they, enhance the reaction of the lung or the airway when they breathe that dust in. And these horses, basically, in the spring, if you have grass again, you put them outside and they say, no more hay. Well, they'll be fine within a few weeks, or sometimes takes a bit longer. So people have really been able to dissect a bit more. For example, we know that moldy hay, of course, is bad, and
Right.
People have cultured actually what type of fungi in there, molds,
Oh, wow.
fungi when you grow it, and they actually then made some mixtures and nebulized those molds, to asthmatic horses when they're...
Jill's face, nobody can see it. We're going to talk about nebulizers. Jill's life was ruled by nebulizers.
Of remission to see if they can trigger the disease, is the molds enough? And indeed, you can recapitulate, the disease by just, making horses inhale that. So obviously, we don't do this on purpose. It's just for the purpose of research to find out, what they respond to. But we did some studies where, I had a lot of owner bringing their horse and telling me, well, but my hay is good quality. And all. So I was, yeah, sure. And at one point I was saying to client, well, just bring your hay, please. I'd like to look at it. And so they would bring the hay and yeah, indeed, it's good hay. It smells good. It's, it's not moldy and all. So we decided to do a study. We said, okay, we're going to have, I have actually a herd of horses with hives that we keep year round. And as long as we keep them outdoor 24/7, they have shelters and they are fed just a pelleted feed. They never see hay.
Yeah.
And they are fine. And these were horses donated to us because owners couldn't manage them at home. So it's possible. You can do it. It's just a very strict environmental control. So we brought those horses in the barn, and then I had our usual hay producer. He makes very good hay, but I said, okay, this year you're going to split your field in two. One side, you're going to do your traditional hay. It takes 3 days or so to cure the hay and then bale it, etc. The other, you bale it a day earlier. And that's the sure way to get moldy hay. And sure enough, so he brought the two types of hay. And then we had horses, they were randomly assigned. First time they come in, they either had the good hay or the bad hay. And we're going to keep them in the barn for a couple of weeks and see how they do. And then we're going to send them back to the farm, back on pasture, and then to give them what we call a washout period so they can recover. And then a month later, they came back and we flipped the things around. If they had the bad hay first, we give them the good hay. Well, we found out certainly the bad hay is bad, so they must have them triggered. But we had also several horses triggered with the good hay. And what we did as well is we measured dust exposure. We had sensors around their nose. And then we also captured that dust on filters and we cultured it in the lab to find out, okay, what kind of mold do we have? What kind of fungi, And then we identified them with different techniques. Well, we found exactly the same types of molds in the moldy hay and the good hay. Well, when you think about it, when the moldy hay becomes moldy, it doesn't come out of thin air. What was there, it's just the conditions were right. You had more humidity, higher temperature. As you know, that's what you need for mold to grow. And so we found the same molds are there. There are just more of them, certainly on the moldy hay. Right. If your horse is very sensitive, that will be enough to trigger some of them. So
I think that's really important to say too, because people that have not managed an asthmatic horse, it is a lot of trial and error, and things that you think are going to trigger don't trigger. I mean, I feel like I've done all these scientific tests in my own barn.
Yes. I just had
employee
numbers behind it, and some science, but you're exactly right. Many horse owners have done that, weighting the hay down, and it does work to some extent, but I have a lot of horses coming that still can be managed, and they've been on wet hay for some time because, it stays wet for so long, and it's warm enough, it's going to dry eventually, and then you're back to square one. So So yes, it is, for me, was a revelation, but kind of something that I felt was pretty true. We just needed to show that indeed, you can demonstrate that.
No, that's really good. So you shared some statistics earlier about the number of, did you say 14% of horses?
14% of horses have the severe form of asthma.
Severe.
So than, temperate climate, we call it.
Right. Because if you go in there sort of online, like everything these days, right, there's a Facebook group for everything. And there's one for equine asthma. And, it seems that people feel that more horses today have equine asthma than they did in the past. Do you think that's true, or are we just better at diagnosing it now?
I think we are better at diagnosing it, certainly, especially for the mild and moderate form of asthma, where, said, oh, yeah, it's just, the horse is not performing as well, but he's got some soreness there, or it's, it's the bit problem, or it's a saddle adjustment. Or, you go a lot of phases trying to figure this out. But now, especially since we do more commonly lung washes, bronchoalveolar lavage, sample mucus from the deep lung, that's the most sensitive way to find out if they have irritation in the lungs. Yes, we find that much more commonly. That's how we found out these 80% of racehorses were affected, So that sounds like an astounding number, but indeed, it is very, very common.
You did that with your pony, didn't you, Jill?
Yeah, so actually lung experts did my BAL for me. We've talked about it multiple times on here because it's come up in other episodes that we've happened to talk about doing a BAL and what's involved with that. And it got to the point that we did that. And it's a pretty interesting process to have it done for anybody. And,
yes.
If you want to explain it a little bit more, I always do sort of like the very highline version of what's happening there. But you get to a point when you're managing these horses that you just want an answer. And if you want an answer, you have to get the BAL done. It's just the only way to really know. And then you can decide on what your treatment's going to be, or, what your next steps are going to be to trying to manage it. I don't want to say treat it because, it's going to be there. But we went through many, many steps to get to that point. And then my vet finally said, let's go ahead and just do this and see what we're actually, because I had lived in Colorado in a 7,000 feet of very arid, dry environment. And I moved to Iowa, and then it just went downhill. And like you said about, your studies that you did with the hay could be completely fine and non-reactive. And, I did all these things. And even though the BAL did say that he had severe asthma, the neutrophils were at 94. We could talk about those numbers, but it really was just environment. And it had to do with the plants, and the trigger was not the humidity. It happened to be the harvest of corn and soybeans that just put everything into the air and, just set it off. So it didn't matter if it was spring or summer or winter. It was always, but I went through all these steps. I mean, steaming the hay, soaking the hay, horse inside, horse outside. I tested the air in the barn. I tested the air quality in my indoor arena. I put more
windows in.
I had more windows put in the barn. I'd changed the ventilation system in the barn. I mean, at some point, there's nothing you can do. And the final answer, which we are currently just finished the test, is I put him on the trailer and sent him to Arizona. And
That's drastic.
It is, but it'd been 3-4 years of managing it, and he got off the trailer and he hasn't had a breathing issue since. 48 hours later and he's fine. Yeah. So there's your answer.
I see that fairly commonly. So we did a study recently where the idea was try to understand, there are regional differences in the type of molds, for example, that horses had. So we used the BL fluid, that the sample we get from practitioners all over the country, and extracted the DNA for fungi, in the fluid. And then we went back because we asked each practitioner, where is the horse, and we need the zip code so we can localize, which region the horse is. And then we overlap that information with a map of what we call the ecological region of the U.S. So there's really maps that can tell you based on your location geographically, you are in, what we consider the Great Plains, or we are in the, in the American desert, or you are, in the temperate climate, northern climate. And we did that, and indeed we found different, type of fungi were predominant in different areas. And what was very interesting is the type of airway inflammations, the type of cells that we can identify in the BL fluid was dependent on the region. So,
wow.
East of the Mississippi River, we had a lot more neutrophils, for example, in the BL fluid. And if you looked at Great Plains, we had more eosinophils, so a different type of, cell. Mast cells was a bit more across the board. But so that was very interesting. So that will be kind of our next thing is, why is this? Why are these different fungi essentially triggering different responses from the airway? So that will be our next challenge from a research standpoint.
Yeah, fascinating. Yeah, and really hopefully useful work for people dealing with these horses for sure. So if when do I decide I need to call my vet and get my vet involved? And if they come out, what are they likely going to do first? Because it sounds like Jill obviously didn't do a BAL on the first time the vet came out. There were, you were a long way down the road by the time you did that. So
right.
Can you quickly kind of just, how should I know as an owner I should call my vet? And what are the initial steps probably going to look like?
Yes. So, very often you want to know, when it's more obvious, like in Jill's horse case, they're breathing fast, having difficulty catching their breath, etc. Often the question, are we dealing with something that's an infection, or is this something that's really not infectious? That's kind of the big dichotomy. So, we certainly want to know, is this the first time this has ever happened? Is this a recurrent issue? Because that's what we were talking about with Yves. It's often a recurrent issue. But, when it's the first time it happens, you don't know. And so a few things is, first, is it affecting the horse health in general? Meaning, are they off feet? Do they have a fever? Are they looking kind of down, dumpy, lethargic or not? Because that typically would suggest more an infectious process, versus with asthma. They usually are still eating fine, unless they are really having a hard time breathing and they are just busy about, trying to breathe. But otherwise, the appetite is not really affected. The attitude, typically is fine. They just might just have that increased, breathing effort. So the next step, after that, obviously the vet will do their physical, listen to the heart and lungs, and etc. Usually look for the nasal discharge. Is there anything that suggests, it's more infectious or not? Actually, interestingly, with the nasal discharge, you can tell. Yeah, even, unless it's really very discolored, but I can show you pictures of gross pus coming out of the nose. Oh, that's an infection. Well, no, it is a horse that has severe heaves. And if you pass the endoscope and look inside, you have a river of pus. Oh. It is not infectious. So sometimes, you have to be careful. So that's why we often go first blood work, because with infection, your white blood cell typically will go up. You may have some specific markers. We call them like SAA that are, associated with, infection and things like that. And basically with infection, all these things will go up. Whereas your asthmatic horse, it's not really a response to an infection. It's an immune response to a more an allergic type response. And those markers don't move. So that's very helpful already to do that. But you always have some that can be a little bit equivocal, depending on the timing. So that's when the next step is really important. It could be just scoping the horse, and again, looking for either excess mucus, do I have something else that explains why there's mucus. Sometimes it's just an upper airway issue, as you know. Horse
Right.
get discharge, it's actually strangles.
Right.
But that could be
Yes.
good. And they can have difficulty breathing as well with that, as you know. But then it's to usually, if you see excess mucus, even if you don't, collecting the secretion, the respiratory secretion is the next best step. So that a big dichotomy there. And if you're suspecting an infectious process, what we recommend typically is do a tracheal wash, we call that. So it's actually collecting the secretion at the bottom of the trachea, not go deep in the lung. But if you suspect a non-infectious, like asthma, a non-infectious process, it's much better, much more sensitive to go deep in the lung and do a BAL. And also what you do with the fluid is a bit different. If you suspect infection, obviously part of it, you want to get a culture to see what, what bacteria potentially is there, what kind of antibiotic might work best, You still treat first with antibiotics quickly if you suspect it's infectious, but at least in the background, you have something that might help you if things don't as fun as well. And then the BL will certainly help confirm or not if you have, asthma in these cases. So that's kind of the approach I would have. So you get to the, like Jill said, you don't get to the BL right away. Typically, you've been dealing with that for a while, and then
Right. So what are, you mentioned sort of antibiotics as initially, so in some cases, what are some other treatment protocols, that you use in these horses? I mean, I'm assuming it probably differs depending on whether it's sort of a mild, moderate, or, severe Heavy horse.
Yes. So to me, because we talked a lot about, what is triggering these things, and hopefully now people realize, the dust in the environment is a main trigger.
Right.
That's the number one thing to do when you consider treatment. Because yes, drugs, and we'll discuss what drugs, help. They will certainly help treat the signs, but if you do not address the cause, once you stop treatment, you'll be back to square one. Okay.
Yeah.
So it's really essential to address the root of the problem. And so that's why I always spend a lot of time trying to understand what are the causes for that particular case, because a lot of horses have very different things triggering their disease. I can give you some anecdotes that are kind of interesting. So once you can do that, reduce dust exposure, which typically means, you have to do something with the hay. Either, you can start by, like Jill was saying, steaming or wetting down, but often, that's at some point, that's not enough. You would have to go to either complete, pelleted feed. That's usually with that you have the minimum dust exposure. What the drugs would do is essentially help improve the signs faster. So, for example, glucocorticoids, so steroids, are the main drug to use to help decrease the irritation, the inflammation in the lungs. So, interestingly enough, what we call non-steroidal anti-inflammatories, like your Banamine, your Bute, that doesn't work. Only corticosteroids will decrease inflammation in the lungs. So that's the one thing, and we'll talk about how you can give it, because you can nebulize it, you can, it's in the vein, you can give it in the mouth, etc., etc. And then the other thing that also helps, because we talked about the fact that the airway would come narrow, and that's why horses have a hard time breathing. Then bronchodilators, like when you treat asthma in people, you have those little puffers, to help dilate the airways. Well, the same kind of drugs can help you. So this would be kind of the two main things. And then, at some point, we probably can talk about also a feed supplement, for example, supplement with omega-3 fatty acids as well, that we found were very beneficial to help recovering of these horses. So I think there was one study that was very nice to help understand what is the benefit of improving the environment versus giving corticosteroid. Study from Mathilde Leclerc in Canada, at St. Hyacinthe in Montreal. And she had horses with hives. They were, initially in the barn, fed hay, and moldy hay. So, of course, they were breathing hard. And then basically half of them, she kicked them out on pasture, no more hay. And then the other half, they kept them in the barn. They were still fed hay, but then they were treating with the inhaled, steroids. And so the horses that were out on pasture, and that study actually went all the way to a year out, so a very long study.
Wow.
Within a month, those horses on pasture started to get a little bit better, but especially at 6 months, they were basically back to normal, and so it takes months essentially for them to get better. And then as long as they stayed out on pasture, no hay, they were fine, they stayed there. And so their lung function got better, their signs got better, and also during BL, number of neutrophils were back to normal, quickly as well. So the horses kept in the barn, they got actually very quickly better on the inhaled steroid in terms of their clinical sign, their lung function, but their BL stayed the same.
Interesting.
There's a big disconnect there. So the point is that as long as the horse continues to breathe in, that dust, etc., that triggers the reaction, you can control the manifestation to some extent, the difficulty breathing, etc. But kind of the fire still simmers, that I would say.
Yeah, it makes sense.
And so these horses were treated on the inhaled steroid for 6 months.
Wow.
So they got down, better, but never back to normal. And then at 6 months, those horses on steroid, she kicked them out on pasture. And no more treatment, just no more hay, but no drugs. And guess what? They got further better. Both their lung function actually improved a little bit more, and they were back to normal. And the airway inflammation then got better. So there's so much you can control with the drugs. And if you don't have any other option, I guess, you're boarding your horse, you can control what is tried and whatnot. That is, an option that works. But you have to realize that as soon as you're going to stop, you're going to be back. And there are many studies that have showed that within a week, if you stop steroid and you don't improve, the environment, horses will be back to where they were at the beginning. So, so I think that study to me drive the point home that yes, you can help with medication, and certainly if you don't have any other option, that's the way to go. Also, you'll get there faster with the medication because within a month, these horses, help with their wear out on pasture took longer. But it's not the end all. And you need to do something about the triggers.
Yeah.
I bought a nebulizer, which was a significant investment, but I thought it really helped. Do you recommend that owners invest in a nebulizer if they're managing moderate to severe cases?
Yes, I do. A lot of the clients that, I do recommend that. And the reason is, yes, as you said, there's a significant upfront investment, but a lot of those conditions, because they are triggered for something that you may or may not be able to control, you're going to have recurrent problems. And the advantage of the treatment with aerosol, it's you basically treat mainly the lungs and not the rest of the body. So compared to being injection or oral drugs, where you can have side effects because they go everywhere in the body, that really just treats the airway, and so it's safer and gives you more flexibility as well. For example, your horse is fine, but you're going to go to a show. It's always dusty. It's going to be problematic. You can either, depending what the situation is, you might treat during the show or as soon as the horse gets back, treat for a week or two to make sure things go back down and to normal, things like that. So that's the flexibility that you can get from, a nebulizer, for example. Yeah.
I nebulized a number of different compounds recommended by my vet, and it took some experimenting to figure out which ones were going to be the most effective for my pony. I think a lot of people think their only option is to give Dex, but we managed without ever giving any Dex. I specifically stayed away from it because I had a pony and I know the risk of laminitis by using it. And so I don't think a lot of people put those two things together, that there's the possibility of laminitis. If the vet says to give them Dex, then you give them Dex. Like, what are your thoughts on that?
Yeah, so dexamethasone is a very potent steroid. So it works very well for severe asthmatic horses. But one of the side effects potentially could be laminitis, founder, as you said. It's not very common, but we see that more in, certainly over-conditioned horses and ponies. As we know, they are often tend to be on the chubby pop, and also horses that tend to have metabolic syndrome, insulin resistance. These kind of things are more prone also to founder if you give steroids, in particular dexamethasone. So a lot of people actually give dexamethasone through the nebulizer, but there are several studies, and we've done a couple of those actually as well. It doesn't work through the nebulizer. The initial studies were done with fairly low doses. And so when we did our studies, we said, okay, well, we're just going to increase the dose. And it didn't work either. And we did that in the severe asthmatic horses. And we did that also, and it didn't work with the highest dose, even giving a bronchodilator before. And then we also tried it in horses with a milder form of the disease, and it really didn't help as well. So now we're trying to do other studies to understand why that is, why dexamethasone works very well if you inject it or if you give it orally, but it doesn't work if you give it through a nebulizer. So hopefully, stay tuned. We'll have more information, soon. But you can give other steroids through the nebulizers. And certainly that can help. As I mentioned, you can give bronchodilators as well through the nebulizer. And you can also administer other form of aerosol through the little puffer. These are the human drugs. We had for a short period of time on the horse market an aerosol specifically designed for horses. They are servo product, but unfortunately it's not available anymore. So we'll have to, again, go back to using human products.
So people are always keen to try and find a supplement to help with conditions like equine asthma. That's always something, when they come to me for nutrition help, especially if their horses have allergy, all kinds of allergies, right? Itchy allergies, airway allergies. They always sort of want to supplement. And so are there any supplements you sort of hinted earlier at omega-3s? And that's certainly something that I'm a big believer in. And I will use for all kinds of sort of inflammatory conditions. But, are there any, is there any research specifically on supplements for equine asthma?
Yes. And we've done some of those, that research. Our initial research was to try to help horses with the more severe forms. So it was actually Hebe horses for the most part, but some with a moderate asthma as well. And we did a project whereby we would both, change the hay, to a complete feed, so these horses were put on complete pelleted feed. All of them, but then half of them were given a supplement with an omega-3 called DHA. And it was actually from the Alera product that's on the market right now.
Yeah.
Get any kickback from them, so I can say that without impress.
Yeah, and I've recommended that too, and I have had people say they think it helps.
Yeah, and the other half were getting a placebo that didn't have the Alera, and the owners were not aware. We had, tub that said A or B, and then we were not aware. Just my technician was doing all the mixing in the lab. And we evaluated horses in depth. We did actually lung function testing. We did BLs. We did blood work to measure, lipid levels, etc. And these horses were 8 weeks on this protocol. And they came back to the hospital in 8 weeks later. But also in the meantime, I was very interested in the evaluation of the owners on how the horse was doing, since everybody, was blinded to treatment. They didn't know what their horse was getting. They had to fill every week a little booklet with a scoring system. We call that a visual analog score. So, for example, if you have back pain, you go to your physician's office. They say, on a scale of 0 to 1, how bad is it? Yeah. So we ask the same for coughing, and for performance and so forth, and breathing difficulty to owners. And I would say this is the type of study. The first time I analyzed the data, I was like blown away by the result, because I was blinded initially, and when I revealed the treatments, it was pretty amazing. So horses on the placebo, for 5 weeks, they didn't get any better as far as the coughing was concerned, even though they were all transitioned to pelleted feed, and then by week 5 and 6, they got better. And by the end of the 8 weeks, the 2 months, 80% of them were not coughing anymore, but you still had some horses with some coughing. Mm-hmm. On the DHA group, within a couple of weeks, they got better. By 5 weeks, none of them were coughing anymore. So it was pretty astounding, the difference, So then we measured lung function, same thing. BL also improved in those horses, whereas on the low dust, only the BL didn't change. So the moral of the story, I always say that, yes, the omega-3 supplement will speed up recovery. It's not as fast as the DEX, it's not within a month. It's going to take, maybe 4 or 5 weeks, but you'll see improvement every week typically. And certainly by 2 months, these horses were fine. So that's kind of my pitch there. We just completed some other studies in racehorse, another study in racehorses. And this time we supplemented them with fish oil.
Yeah.
And this was a different approach where we know that, on racetracks, it's hard to change their diet. And horses, there are many reasons we can understand why it's good for them to stay on hay. But we wanted to know, does just supplementing with fish oil will help reducing their airway inflammation, since we knew 80% of them had subclinical disease. And so half of them, again, at random, nobody knew. They had A and B. They had little individual packets, and it was corn oil or fish oil. And actually, you couldn't tell even if you opened the packet. As you know, fish oil, if it smells fishy, that means something is wrong. It's been oxidized and kept open to room air for too long, and now it's not good. But if you look at, good fish oil, well preserved, it doesn't smell fishy, and it just looks the same, Tastes a little bit different. Vouch to that. But everybody, all the horses consume that. We had over 80 horses in the trial, so a large trial, different tracks throughout the country, California, Florida, etc., and here in Indiana. And the bottom line, only 4 weeks of treatment, and we could see a benefit after 4 weeks in the one on the fish oil. Their BL neutrophils went back to normal. The others stayed exactly the same flat line. And the kicker, we looked at performance, and guess what? Horses that were on the fish oil, their earnings went up,
Wow.
Compared.
Now I feel better because I recommend fish oils, and I'm feeling very vindicated in my recommendation.
But
I've had many conversations about fish oil.
Yeah, as you know, when we talk about omega-3 fatty acid supplement, there are a lot of different type of omega-3 fatty acids out there. And, it's very common to see on the feed bag, omega-3 fatty acids supplemented, in that feed. But the main source often is flaxseed oil. Yeah. And flaxseed oil, all the, plant products, so grain and even grass or flaxseed oil can only deliver the first step in the omega-3 chain of fatty acid.
Right.
Is that, alpha-linolenic acid. So that ALA. Us, we consume that. All mammals, cannot make the ALA. We have to take it from our diet. And then we can synthesize DHA and EPA, which is another important omega-3 fatty acid that's present in fish oil. So my point there is a lot of the feed have the first step, the ALA. Unfortunately, horses don't have a very good ability to make EPA and DHA from ALA. They don't have any time in sufficient amount. You can give them a lot of flaxseed oil and you don't detect any increase in downstream product like EPA and DHA. So it's important to give actually those products for horses that don't have access to pasture. So that's why we think racehorses are so prone and have so commonly, airway inflammation. They don't have access to pasture. They are fed on the hay. They are in their stall, 23 out of 24 hours. And so they are, even though they are not exposed to very high level of dust, we measured that in that study, because they don't have their natural ways to keep things under control. There's natural anti-inflammatory that are omega-3 fatty acids. They have low-grade inflammation. They affect their performance.
Yeah. And that would be true of horses in a lot of high sport horses too, right? Because they're so, they don't get turned out on pasture very much because whatever reasons, and so they're mostly on a hay-based diet. So
the other thing that helps, we did a study that was prior to that study at the racetrack as well. We wanted to see, since we knew dust was triggering airway inflammation in those racehorses, so, okay, can we give, forages that can decrease dust exposure? So we did that study with 3 groups. One group, again, at random was getting their regular hay, another one was getting steam hay, and the other was getting haylage.
Yeah.
Those that are not familiar, haylage, you think about silage in cows.
Yeah.
Very wet, forage. Well, it's kind of the same, except it's not as wet. It's just still, it's instead of harvesting you're cutting your grass and let it dry completely. So you have only, 15% at most of humidity in there. You just bale it sooner, like when there's about 30% or so of humidity. The problem is, as I talked about earlier, if you don't do anything else, it will mold. So what you do is you protect it in a plastic film, so it's, you don't have air coming in, and so it's anaerobic. And so in that study, we had a producer here in Indiana produce those bale and the plastic seals, and horses were fed on that for 6 weeks. And indeed, we found that this was so real life horses at the track, not in the lab. Mm-hmm. We measured dust in their nose, around their nose, in what we call the breathing zone, and we found there was about 30% reduction in dust exposure when they are either on steam hay or on haylage. And interestingly, so we were doing BLs in those horses before, in the middle, and after. And after, so on regular hay, actually, nothing improved. If anything, their airway inflammation went up a little bit. Haylage and steam hay went down, but steam hay was kind of down a little bit at 3 weeks and kind of plateaued. On haylage, it continued to improve, and they had less neutrophils at the end. They were really within normal limits. And then we reduced the dust exposure about the same amount, so we wanted to understand what happened. So we measured their blood lipids, before and after. Yeah. Well, their EPA went up on the haylage. Not on the other. So somehow, even though they just got ALA, somehow there's some other compound that we need to figure out what they are. It really helped upregulate, EPA in their blood, and presumably that's why they had less inflammation at the end.
That's really interesting.
How we compute and say, okay, well, what about if we give just EPA and DHA directly? So that's how we got to the fish oil.
Yeah, makes sense.
So unfortunately, not many people make haylage in this country, but
No.
it's very popular.
Yeah, we do. Now we almost do it exclusively in England. It's way more common than hay.
Yes, yeah, it's very, very easy to find in Europe. Yeah.
Well, there seems to be a lot of interest among those managing horses with these conditions about some new technologies, like, for example, shockwave on the lungs, alpha 2EQ, and halo and salt therapies. Like, what do we know about those approaches, and is there any research to support their uses?
The short answer is there's no research published, no reviewed that support their use, but they are used more and more. I think, the equine world has been always very creative and imaginative and at the forefront of trying new things, which is good on one hand, because sometimes, the problem with the research takes a lot of effort, long time, and a lot of resources, financial in particular, to do that. And so there's so many things that can be done to help. So I think it's good to have people that are at the forefront trying new things. But like every new thing, you need also to show, is it helpful? And at this point, none of the approaches that you've shown, you've talked about, they published any randomized controlled trials or anything like that demonstrating efficacy. It was actually interesting. During our racetrack study on the fish oil there, I was at one of the track, and some of the horses were being nebulized with the salt, and actually it was the first time I heard about it, but the first time I was seeing it being done. And the horse seemed to be fine, no problem. And so after they were done, I said, okay, I'd like to breathe it in to see what it feels like. My regret. And I stopped coughing like crazy. So clearly maybe not as good for people as it is for horses. But yeah, so I think, the issue is that we see a lot of claims that can be made. I think that two things that I always look at is first is what I would call, what is the biological plausibility? So what is the mechanism that you might think would be at play here to help, control asthma, for example? And so then you have kind of your hypothesis, this is how it works, and then you do your experiment, you try to prove whether or not indeed this is the case. So that's what we did, on the omega-3, for example. And but unfortunately, there's still yet to come. But there are some cases like shockwave. I'm trying to think, okay, what is the mechanism that could potentially help? And I really don't understand how it's physiologically possible to help a horse with asthma with shockwave, because as you know, you need that probe that, the vibrations, down the tissue. So typically, it's done for bones or tendons and things like that. But you're on the bone or you are on the tendon, you have to go down in the tissue just by a very small amount. The lung is obviously extremely thick and deep. So, at best you would go at the periphery. And as you know, air is a very good insulator of sound. If you want to have a booth that's insulated, when you're in your recording studio, that's what you need to have is, alveolar panels, with air cut into alveoli. Well, that's what the lung is about. So I don't understand how you could expect, the lung to improve, based on that. And so, I'm love to learn how that could be the case. And I would love to see actual study being done to prove that maybe I'm wrong. And
you sound like me. Like I'm always an open-minded skeptic, right, about things, right? It's like I'm open-minded, but at the same time skeptical until you show me the data. So,
well, I can tell you an anecdote along those lines. I had a person making a device that was actually a sound-based device to treat asthma, and this was actually had a little bit more biological plausibility. And here it is. In people, there have been some studies done where there was a sort of an instrument like a flute, if you will, and you blow through and it, makes a sound and propagates into the airway. And they've showed actually through some studies that it does have some effect on the mucus, thickness and then the airway tone as well. So there was a little bit of an equivalent there. But this case, this person had developed a tool, a device that you put on the horse's nose, and it's a loudspeaker in there and sends, pressure waves, sound waves through the airway. And he had a fairly compelling story on one of his family, person member. It was interesting. So it kind of convinced me, I'd like to try that. It's really, it's all the drug, obviously. So that's very appealing. So we did a randomized, to his credit. He said, yes, I'd like to invest some money and I'll pay for a clinical trial and well-designed. So again, we had some horses were treated with this. And I said, give me your best protocol and we'll do it on heavy horses. And the other horses were treated with a sham, I call it. So I had a device on the stall door so horses could still hear the sound, because I thought, well, maybe it's just the reaction to the sound, not the sound traveling in the airways. And we followed these horses for 4 weeks. They were in the barn every day. They were treated in an evening. It was very laborious. We did lung function testing, BL, stuff, clinical score. Well, at the end of the month, guess what? No difference, no change. Lung function stayed the same. So he was very disappointed. I was disappointed too, because I was, trying to give it a fair shot, and see where the chips would fall. And unfortunately, it didn't work out. So I think sometimes you have to be game. I'd like to have some, suggestion of how that might work. And in this case, for example, there was some suggestion, and it just didn't pan out. So you just move to the next thing.
Yep.
Well, we have covered so much information. I mean, there's just so much. I mean, we could be here for days and days talking about.
We only talked about asthma. There's so many other things that go on in this nurturing tract.
But before we go, is there anything else that you'd like to share with our listeners about equine respiratory health, or either related to equine asthma or just general respiratory health?
Well, maybe I can tell you a few things we're working on. So since dust is such a big deal, so we talked about, you can try to change the forage. Sometimes it's hard, a drug, supplement. Well, we thought, what not developing a dust mask?
Oh.
So we just did that. We actually got a patent on it, and we did a pilot study. And so we hope it could, potentially be available, on the market at some point. So, but it's something that horses can, wear on their nose. As you know, they are obligatory nose breather. That was the idea. So if you bubble just the nose, but leave the mouth, free, and they can eat and drink. And indeed, that's what we found, in our horses. So, so hopefully more to come soon on that. And then the other thing that we do is we've developed a small dust sensor. We've evolved quite a bit, and the technology has evolved. In the old days, you had to equip the horse with a pump, so you put the surcingle, attach the pump, the tubing to the head, and the sampler around the nose. We've worked with some engineers on campus and a collaborator at University of Iowa to have a sensor you can attach to the halter. So you're close to their nose, and you measure dust in real time. And then on top of it, we put a little drone camera, so we can then see what the horse is doing, and at the same time, what dust is exposed to. So we can be much more specific in recommendation. And I've used it with clients. They said, I remember one client coming, she said, I know what is triggering this horse is the arenas we have. They are too dusty. And I said, okay. So we test the horse. Indeed, the horse has asthma. And I sent her home with a sensor and with a camera. I said, okay, you put it, first I want to measure the background in the stable. So you just put it in the barn, on the stall door, when they do more regular things. Then put it on the horse when you ride him. There were 2 arenas, arena 1, arena 2. And then I really want to also see when you bring back and feed the horse your hay. And she said, oh, yeah, by the way, the barn has their own hay, but I buy my own because it's better. And so I look at all the data afterwards, and the horse in the barn, very little, activity. In the arena, very little. Arena 1, Arena 2, about the same. Horse back in the stall, eating hay. Eating the poop hay. Not as high, but still, So I think this is also a very good educational tool, because I could, give her a copy, a snapshot of what we found and with a dust sensor. And so again, hopefully this is something that we could potentially, have available, for people to use in the field. And right now it's still a research, tool, but that's certainly, I would say, the future for that type of line of work.
Yeah, that's cool. I think one of my sort of passions when I learned about equine sort of airway health was really trying to encourage barn owners not to do things like blow the barn aisle with a leaf blower when the horses are in the barn. Right? That is one of my pet peeves. It's not good for your airway health either. The people working in the barn, and it's, and when my kid was in third grade, we had a parent, if your parent worked in a STEM subject, have them come in and do an assembly thing where everybody had a table and kind of did what they did for a living. And I had, it was supposed to be interactive. So mine was, density versus weight, sort of volume versus density type stuff. So I had some balance of pellets, I think. And it was teaching the kids that, a cup of one thing wasn't the same as a cup of something else. Yeah. And the guy on the table next door, I lived in California at the time, and he worked for the California Air Resources Board, and he had a little thing for air quality, and he had an air quality meter with him. Yeah. And so I had him come over, and I poured a scoop of pellets, grain pellets, into a bucket and had him hold the meter as I poured these pellets in. Yep. And because I have sort of respiratory allergies, and I could smell it, and it was making my airway tight. And when he read the level of particulate matter that was in the air once I dropped those pellets in that bucket, it was shocking to me. The really small, was it 0.2 parts per billion particle size or whatever? It was off the charts, bad air quality. And I think we just don't think about the air quality just in our barns, mucking out stalls with the horses in the stalls, blowing the barn aisle, sweeping, moving hay in and out of the barn while, if you're stocking your, hay shed or whatever is in the barn. All these things kick dust up in the air that really impacts our airways as well as our horses. So I'd encourage our listeners to really think, even if you have a horse that's totally healthy, in inverted commas, because maybe it has an airway issue that you don't know about, it's all these little things contribute and have an effect.
To the choir here, and I would add that some studies actually looked at the health of people working with their horses in barns, and guess what? The higher
not good
rate of asthma is in those folks that either they work on the racetrack or in horse barns in general. But Mazan looked at that in horse barn. Others have done that at racetrack barns, and but tell those people they can't work with their horses anymore and no chance. So but they don't have to live in the barn 24/7. The horses
right.
So
for sure.
So that's kind of the big difference, I think.
So if our listeners are interested in learning more about your work in equine research at Purdue, is there somewhere that they can learn more about what you're doing?
Yes, of course. Yes, they can, just Google Purdue Equine Sports Medicine Center. They'll see a lot of information, both on the research we do, on a link to articles, and, a variety of information. We have a newsletter we put out on a regular basis, and a wealth of links and connection to other information about the research we do. It's... I'm interested in the respiratory stuff, but, we have a lot of other researchers here that are working on, bone fracture and upper airway issues, sepsis in fall, et cetera, et cetera. So a lot of different areas. So that would be one source of information, yes.
I'll put a link in our show notes for that.
Great.
And thank you so much for being our guest today. We really appreciate your time and your willingness to share your expertise with our listeners.
You're very welcome. It was a lot of fun. Appreciate it.
Thanks.
Have a good one. Take care.
For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com and is spelled out. You can also find Claire at clarityequine.com.
We know that if you're like us, you're probably listening to this while driving or doing barn chores. But when your hands are free, if you'd share it with your friends on social media and be sure to subscribe on your favorite podcast platform, it helps other horse lovers like you to find us.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.